Okay. Good evening, everybody. It is 7 o'clock, and because we are a government entity, we do start on time and we adhere to a schedule. That keeps us legal. So anyway, my name's Jim Sheeline. I'm Finance Chairman, and this is the Finance Committee. As soon as Mr. Book comes in and sits down. Becky, would you call the roll, please?
You sure will. Jim Sheeline.
Here.
Jennifer Dallas.
Here.
Tom Kitson.
Present.
Mike Book.
Here.
Nancy Naylor.
Present.
Reed Acree.
Here.
Jason Anderson.
Here. All right, I never have a chance to look at the minutes from, and it's, I know Becky gave us the minutes from last year, but the minutes that we are approving is actually from the budget overview. So did everybody have a chance to review those minutes? Any additions or corrections? Hearing none, entertain motion to approve the minutes. Moved by Naylor, second by Kitson. Notice I got that right.
Thank you.
You're welcome. All those in favor signify by saying aye.
Aye.
All opposed, motion carried. All right. Jeremy, as far as, do you have anything for us besides what's on the agenda?
No, sir.
Mr. Frails? All right. Let's see, and we will go right into organization presentations. Is the idea we'll just go down through from the schedule on the spreadsheet? Okay. So Lee County Council on Aging. Who gets the duty tonight? Oh, there she is. Come on down. So we're gonna, instead of going to the podium over here, you know, as you guys come do your presentations, come join us at the table. And if we need to grab an extra chair or whatever, that's fine.
I'm Susie Ross. Nice to be here.
Yes.
I'm coming from Lee County Council on Aging. Our mission is to try to keep seniors in their homes and in their communities. And we do that through a variety of different programming. Some of it is busing, some of it is activities for seniors, isolation, that type of thing. The other is helping them fill out any kind of application there is, whether it be SNAP benefits, Medicaid benefits. Nowadays with the new Medicare, they have to sign in and say that they are who they are. So that can be difficult for anyone that's aging. Last year, we did about 30 units of service. So we see a lot. We have, well, about 9,000 were bus rides, so trips. And then 20,000 were 1 hour units helping seniors, whether it be with isolation, whether it be with assistance, that type of thing. We have weekly exercise programs free of charge for the seniors. We have weekly food pantries for the seniors. We also have daily congregate meals, thanks to partners like Lifescapes. Thanks to OSF, we're able to give meals to take home on Tuesdays and Thursdays. We have a lot of people that network with us. So we have, this month, we have a CNA that's volunteering and doing blood pressure checks for the seniors. So it's just wonderful to see everybody bring in their gifts.
Susie, do you know how many seniors in totality you serve in this community?
Well, we serve Papa, Ashton, Franklin, Amboy, besides Dixon.
Okay, but how many seniors the question just may be confusing to I mean,
No,
ask
I
it correctly.
didn't look at how many
You don't-
unduplicated seniors we served.
Okay.
I only
Yeah,
looked at the
undu-
units of
unduplicated.
service.
Okay, thank you.
So for isolation, I know it's 400 that we serve for
Okay.
that one program.
Mm-hmm.
For senior, the buses, it's around 350 to
Okay.
400 unduplicated.
Okay. Thank you.
So I got a quick question is, now you mentioned the bus service. You guys running 2 buses right now?
3.
You run 3. Okay. And then you're also using, some of your clients will use the Reagan Mass Transit
Right.
buses.
Reagan actually funds us, so it's all them, you know.
Right.
But our clients take a little more time. So we take the hard ones for them so they can get more people serviced with other routes. Yeah.
Gotcha. And that system has worked out well for you guys?
I think it's wonderful.
Yeah.
Good. Greg tells me what's important and what I have to do, and I do it.
Yeah. That's great.
So,
Good deal.
Our board really thinks it's important that seniors have that special one-on-one that our bus drivers can give and give a little bit more. The board really likes that, and it really helps take some of the problem children off Reagan's
Mhm.
hands. So it's wonderful. We
Yeah.
help them, they help us.
Mr.
One of the
Kitson?
things that
Yep.
she tries to do too is offer free to, seniors to ride free to come to the senior center. They can't afford it, which is nice, getting them there for free.
Go ahead,
Susie,
Tom.
the difficult question, I guess, is we think what you guys do is wonderful. At least I do think what you guys do is wonderful. But as we go through more and more years of state mandates without state funding, it becomes more and more difficult for our budget to continue what we do the way we do it. If in the future we couldn't support you at the level we do and have tried to, is there an alternative method? Have you guys, I guess what I'm saying is, have you looked at anything else for alternative revenue to offset part of what we're doing? Because we have more people coming to us looking for funding. As the world just seems to tighten up, everybody's looking for funding, and I understand it, but there's a limit to what the county has. And for future years, I just know if you guys have looked at anything for different funding or.
We're in the same boat because we're hearing from our federal and our state funding that they're gonna, maybe cut back as well. So we get it, we understand. But,
Okay. It's,
we do our best. She does a lot of fundraising, we do a lot of fundraising.
Every other month.
Yeah.
I mean, it's
And
difficult.
speaking of which, Thursday, we're gonna be having a root beer float fundraiser from 2 to 4 with singing styles of Larry Scored. So please come along and sing with us and open your pocketbooks
And where's that at? Right,
at the senior center.
At the
right
senior center.
across the
Sure.
Street.
Yep.
2 to 4 on Thursday.
Yeah, I should be.
And if you've never been to the senior center, it's really been spruced up.
It's
Jason?
just under
Yeah.
600,000. For all, yep. We do able to bring in some of our own money through the Post House Ballroom. That's our biggest fundraiser there is. So if you have anybody getting married or retiring, please think of us.
Can you use your mic, Jason? So
Yeah.
you gotta turn it on.
Yeah, you gotta turn. Yeah.
Sorry.
You
It
need-
just
I'm
makes
the
it-
new
you
guy.
need-
I know,
yeah.
that's why I apologize, but it's just.
How do you promote that service? How is that done?
Right now, it's been through Facebook.
And what other sources of revenue do you have?
We get 210,000 from Reagan Mass Transit. And we provide them with a 24% match back And then we have a state fund that's a matching fund for transportation. That money is about 33,000, but it goes straight back to Reagan. And then we get NIA funds of approximately 10,000, which is a matching for
What kind of funds?
NIA,
I'm new to this, so I don't know. what that-
older Americans
Northern
funds.
Agency for Aging, what it stands for.
But it's the federal Older Americans Act.
That's the federal and state funding that is, we've been told is in jeopardy.
And we get about 100,000 from NIA, again, just for regular helping seniors. And then the rest is like fundraising. We have senior trips that we do. We have the post house. We even have pop that we sell downstairs. We do just about anything we can to,
Do the senior citizens themselves contribute to any of this?
with memberships, yes.
Memberships?
And then they come to our fundraisers. Recently, we did a senior prom. And that was lots of fun. And everybody got up and danced. You would not believe the good dancers we have in Lee County.
So this year, last year, your request was $72,000. We were able to fund you at $60,525, and your request is $65,000 this year. Is that correct?
Correct.
Very good. I guess I should have mentioned before we got started, so what our process is here, and this is for everybody, no decisions or final decisions are made tonight. This is your time to present to the finance committee and explain what you're all about and talk about your requests. The finance committee, as you can see, you're going to be asking questions and whatnot. And then, you know, we go through our budget process and we do what we can. So just so everybody knows how it works. So anyway,
How are you staffed? How many staff, full-time, part-time do you have?
Everyone there is part-time, except for me and my assistant. 15.
Part-time?
15 staff.
They're generally retired, which usually works good for part-time help. We'd love to be able to have everybody at full-time, but we can't afford that. We've had to go through minimum wage going up, and then the new time off for all. So yeah, it's been difficult at best, but we've done it so far.
To work for a lot of volunteers too that come in, you know, to help with things. It'd be hard to keep it going.
Mhm. In the building, you own the building?
Yes, we do.
And this budget of 600,000 covers all maintenance and all the requirements to keep the building up? And utilities and so forth?
Yes. It has so far. I'd like to do something about our foundation and painting it. And I keep on asking for grants to do that, but I haven't been successful yet. We did get a grant from Do It Best that helped get some of the flooring fixed inside, but
Do you do any, you mentioned sponsorships. So do you go out and do marketing and, you know, go out and ask corporations or businesses in the area for donations on a regular basis?
we have a membership for businesses and
Okay.
it gets mailed out to them.
We list them on our website. We thank them on our website for the businesses that membership.
Yeah.
very good. Any other questions? Hearing none, well, thank you.
Thank you for your.
And we will let you know. Thank you.
Can we ask, do you have any questions for us? Okay.
Okay. All right. Okay, next is Lifescape. Good to see you in person. I think you were on Zoom last year.
My son was in the hospital. I drove back from Madison to go sit in my basement. Thank you for allowing me to be on Zoom last year.
Oh, absolutely.
So my name is Mike Hughes. I'm from Lifescape Community Services. We actually perform 4 programs in Lee County specifically. We are the Adult Protective Services. That's the old elder abuse. We are the Adult Protective Services for Lee County. We're also the Care Coordination Unit, or the CCP, for Lee County. We also run a retired senior volunteer program for Lee County. And we're also the nutrition provider for Lee County, that we do Meals on Wheels and congregate dining for Lee County. Last year, we stopped asking for money for anything except for our nutrition program. The reason for that is last year, inflation hit our budget very, very hard, and food costs, I did the calculation for somebody else. Since 2020, our food costs per unit have gone up 45%. That's what our food costs have gone up. We spent $2.6 million on food last year for not just Lee County, but the 4 counties that we have and some of the other things that we do for our food contracts. So I can tell you about a lot of different numbers. We can talk about all those things, but I wanted to answer some of the questions that were asked previously to Lee County. Number one, what would we do if you couldn't help out with the Lee County senior tax levy? I will answer it the best way I can, and this is probably counterintuitive to my cause. We'd figure it out. I think everybody here that runs a nonprofit will tell you we'd figure it out, because that's what we do. We try to make everything work to not touch our clients. Our clients are sacrosanct to us, and I think everybody here would agree to that. And I know a lot of these people, we work on a lot of different things. One of the things specifically that Lifescape does, we're a little bit bigger. We have been working on almost as a business model to grow our services, diversify our funding sources. I'll give you a good example. Last October, we opened up an office in Lake County, Illinois, in the Chicago area. We are the Adult Protective Services provider in Lake County, Illinois now. We have an office in Sterling Rock Falls. We picked that up in 2016 to be an APS and CCU provider. And starting October 1st, we will add McHenry County. We will be providing Meals on Wheels and congregate dining to McHenry County. So we believe that in that growth, as a business sense, things become cheaper, right? Everything becomes cheaper if you're able to grow. As long as it doesn't impact our quality, and as long as we can still take care of our clients, we think that that growth is a positive thing. So we're going to be growing again starting October 1st, and we hope to keep that up. The problem becomes, and they talk to you about NIA funds or the Older Americans Act funds, those come with matching fund requirements. So every dollar we get, we have to match 15% from local sources. So as we grow our Meals on Wheels program, we will be fundraising in McHenry County. We fundraise in Ogle County. We fundraise in Boone County. We fundraise in Winnebago County. These are all places where we got to match 15% of every dollar that we get. That has to be from a local source. So we have the distinction that we don't have a wait list for our Meals on Wheels. And as long as I'm executive director, we will never have a wait list. A lot of Meals on Wheels providers across the state implemented wait lists as soon as they were able to, as soon as quote unquote COVID was over. We will never have one as long as I exist as executive director. So people come to us. We believe that the meals are just a reason to serve. The other reason is to serve as a wellness check to that client, to that senior, to make sure that they have somebody that sees them in the course of the day. So we serve thousands of meals. As you can see, we served over 23,000 meals in Lee County alone last year. I can talk a little bit about the APS and the CCU, but I'm not asking for funding for those, but we can have that conversation as well. So I come here, many, many years I've been coming here. I've spoken to a lot of you, but I don't know what you want me to cover or not cover, so I'll open it up for questions. We do have this pro-growth mentality because just like in business, things become cheaper if you grow. If you have the more you can diversify your funding sources, the more you can do those things. It becomes easier to serve the clients.
I guess I have a curiosity question as
Mhm.
far as the adult protective services
Yes.
side of that. Has that been, you see a trend on the need of those services? Is that, you know?
No question.
Yeah.
So we picked up all adult protective services when another organization gave it up in 2016, and we came and took that over for Lee, Ogle, Carroll, and Whiteside counties. That's where we serve those are. I will say the myth that the state of Illinois had is that adult protective services is going to lose money, and because of our business practices, it's a break-even proposition for us. We don't lose money on adult protective services because of the way we run the program. So the need, every time we go into, like we just picked up Lake County in Chicago area in October, they went from about 10 cases a month, and we have about 90 a month now. Because we ramp it up because we believe that there is abuse going on, and we just have to get people into the services. There is no question a need for those services. From my perspective, my adult protective services investigators and that staff, I leave them alone because if something gets to my desk, something very bad happened, right? So the vast majority of our cases are financial exploitation and neglect. That's the vast majority of them. But no, we have sexual abuse, physical abuse. We had one case it was in Ogle County that we were actually delivering Meals on Wheels to them, and it became an APS case where we had to get subpoenaed by the state police because the people were accepting the meals, eating it while their loved one was passed away in there and rotting in the house. So, I mean, it's a huge problem. The underbelly of, and I think everybody here will tell you this too, the underbelly of serving seniors, we have some successes, but there's a lot of neglect. There's a lot of abuse. There's a lot of, I'm not going to worry about it anymore that they're a senior citizen. There's a lot of that goes on. So we see that kind of underbelly. So APS is one area where we take very seriously. We need the money for food. The food costs are outrageous for us right now. We don't want to provide an inferior product to the senior just because they're seniors. So that's why we're asking solely for food.
Sure. I understand. Thank you. Tom?
Yeah. We may have asked you this before, and I
Sure.
apologize. You do supply the meals, I think they said, to
Mhm.
the senior center.
Yep.
How do you guys determine where you go and where local Meals on Wheels go? Because that's in town.
Yeah.
Can you, and I know you'll give us some more of that later, but just an understanding of how you decide who.
So we are
supports it.
funded through the Older Americans Act. Okay, so the Older Americans Act was passed in 1965, and it's correct. It's one of the alphabet soups from LBJ. And so in 1965 it was passed, and how that works is that it created what's called area agencies on aging, right? We work under NIA, which was spoken about before, Northwestern Illinois Area Agency on Aging. The thought process was that local communities would know more about how to serve their local people. So the Area Agency on Aging for NIA serves 9 counties, kind of northwestern Illinois, from Carroll County over to Boone County, down like DeKalb
Okay.
on over. Those to become the Meals on Wheels provider or anything else in the Older Americans Act. There's a bid process every X number of years that people at organizations bid on that, put in what they would do for how much the grant is, and how much, and you held accountable to those standards. So we are funded through the Older Americans Act through the federal government. It used to be called the Association for Community, or the Administration for Community Living, but that's been eliminated. So I don't know where our grants live there, to Illinois Department on Aging, to the AAA, which is NIA. So that goes through that. So we are designated the home delivered meals is the legal definition of it. Home delivered meals. Meals on Wheels is an association we belong to. And so we're designated that through the federal, the state, and the local authorities that designate that.
Okay, thank you.
Sorry, it's a long history lesson. I
No,
apologize.
that's, no, I appreciate it.
You ever want to read
I
federal
know you
law?
cross lines, which is how you know.
Yeah, as long as we're serving seniors, I'm good with everything. As long as we're taking care of the clients, I'm good with all of it.
Or, go ahead.
Oh, so on your application, you said you served 215 seniors in Lee County for the most recent year, 2020.
That was for just for Meals on Wheels. That's
Just
what
for
I'm
Meals on
asking for. Yeah, that's correct.
What is the trend
Oh,
in
sure.
that number been like? Bless you.
Upwards. Upwards.
Okay.
So the demographics statewide, local, is number one. I always say that the population aging as fast as it is did not catch anybody as surprised except for like policymakers. They're the ones, oh my goodness, there's all these old people in the country. And they're the only ones that didn't see the trends coming, right? And what we see is people tend to be working longer because of economic pressures, those types of things. People tend to be more engaged as they get older. Now, by the time they need services, and I think they'll all tell you that too, by the time a senior comes to need services, they're older, sicker, poorer, frailer, right? They're not the 65-year-old that it used to be 30 years ago that was getting service. It's the 80-year-old that's coming in, right? So the fastest growing demographic in the United States is people 70 plus. That's the fastest growing demographic. So
No, just, yeah, so talking about specific to Lee County.
yes.
So we know that 215, do you know kind of where those numbers, and have you had to deny any services in Lee County?
I will not deny any services ever. I will never deny services to anybody ever. If you don't fund me, I still won't deny services to anybody ever. I will not do that. We will figure out how to serve people.
And then how do you guys do that? Is this bringing in from other, I'm sorry, I don't know the process.
Sure.
So can you explain that? How that
Sure,
works?
we have a kitchen, a commercial kitchen in Rockford, and we serve the 4 counties out of those kitchens. We have a partnership with a senior center in Oregon that we put our vehicles there. We take the food from Rockford into Oregon. We transfer it to drivers who live in that area, and we drive it to the clients in Lee and Ogle counties there. So we have a central kitchen that we produce the food that's cheaper than if we were to buy the food. So that's how we do it. Nothing ever gets cold. It gets from the oven to a warm truck to the client's hand. So, and how they get hooked on generally is through, a lot of people will request through other services. We work really hard with different churches. We have a good relationship with all the hospital systems, discharge planners. We are the CCU, which a lot of things come to CCU for. We refer them to ourselves in Lee County. We are the CCU. So they're already in the houses. We are the APS, so we can already refer to ourselves. So we rely on a lot of partnerships to get the word out for that. They call into us. Pretty much after they call into us, we verify that they qualify. Like 2 days later, they start getting mailed.
How do you qualify?
So essentially, to break down the entire law, it's essentially this. There has to be some impediment to feeding yourself, right? So that could be economic, that could be you're poor, right? That could be physical. That could be that you're socially isolated to such a level that you can't get out and feed yourself. So there has to be some impediment to you feeding, taking care of you and feeding yourself is what the qualifications are.
And how do you determine that?
So we have caseworkers that talk to every one of our
Okay.
clients, and we have an application that we go through.
Okay.
And we make sure that there's, if they're, going to the gambling boat every Wednesday, they're probably not shut-ins. You know what I mean? So we try to work through with them. We work with a lot of family members more than we work with
So you
clients.
you have to be a shut-in to qualify.
Essentially, that's the word essentially that's it is. But it could be an economic issue too, right? You don't have enough money to buy groceries. That is a reason to get Meals on Wheels. There's an impediment to you being able to feed yourself. And we know that the mortality and morbidity rates, if people don't get the right nutrition, and people start becoming prematurely institutionalized, is what we exist to stop that premature institutionalization. We know that the safety check every day that we see them, plus the healthy nutrition, we know that they're going to have better results for that senior going forward.
And do you have fundraisers?
We fundraise all the time. We run a huge 4th of July race. We had almost 800 runners running it this year. We run a senior expo that it's in September that people come to. We fundraise all the time. We're constantly fundraising.
And how many counties did you say you now cover?
So we cover if you add McHenry County, which will start, we cover a little bit in 11 different counties. But for Meals on Wheels specifically, we only do Winnebago, Boone, Ogle, and Lee, and October 1st will be McHenry.
That's a big area.
Yeah, we're excited about it.
Yeah.
I'm excited about it because I know we're gonna do a good job. I know we're gonna take care of the clients. I know it because I know my people. I know the people who work there, so I know we do a good job in Lee County. We do a good job everywhere we go, so.
How are you staffed?
So we have about 120 staff, about 65 are part-time. There's a lot of drivers, servers, those types of things that we have. The rest are full-time employees.
And you said a total of,
120,
and 65 of those are part-time.
correct. And we have 28 drivers, and 28 different routes that we have, plus we have servers at our congregate sites and things of that nature, so.
Thank you.
Okay. Reed?
Just one more question.
Yes.
And
Please.
forgive me for my ignorance
No,
on it.
okay.
Is it 7 days a week or is it?
So what we do is it's 5 days a week to deliver the hot meal. And then on the weekends, if our case managers, our home delivery meals case manager, Meals on Wheels case managers, determine that client needs a little bit extra, we deliver frozen meals for the weekends.
Very good. Thank you.
Can you say for your total operating cost, because I see obviously 8.5 million.
Yes.
What % of that would you estimate for Lee County?
So that's a good question because we do so many different things and it's a little bit more difficult for, because like APS, we don't get paid unless we have a case. And so, boy, that's a good question.
Or just your total operating budget for Lee County? Because I know your ask is 11.
It's more than $11,000. So I would say it's a really difficult question to answer, but I'm going to give you, I would say probably 10% of our budget would be for Lee County, something of that nature would probably be, that's a guess. But, I used to love to brag that we could take a meal and make it and package it and deliver it for under $5. I can no longer say that. So our meals cost delivered about $7 a meal. So you can do the math on that and see how many meals we had. It's just a difficult, we do a lot of we don't have caseworkers for APS just for Lee County, but we do have cases in Lee County. You see, so it's hard to break that on to a budget.
And some of your meals are supplemented, correct?
Supplemented.
Like they're not paying full price, right? But it's based on income?
Nobody has to pay anything if they can't. So the Older Americans Act mandates, this is the law, that clients we have to give clients a way to anonymously donate towards the cost of their services. That's the law. So what we do is we do what's a sliding scale, and we mail out a letter every month and say, okay, you don't have to give us anything, but if you'd like to, here's how many meals you had based on a sliding scale, based on your income. Here's what you can donate to us. If they don't donate to us, it's anonymous. We don't know that they give us. But if they don't donate to us, we don't know it, and we still deliver them the meals. It's a free service.
Oh, wow. So you really don't even know what income you're getting from Lee County for meals?
Not in terms of that. No, we can't. We're not allowed to track it. Yeah. We're not allowed to track it.
What
I will, I'm sorry?
What kind of response do you get? I know you don't know, but if you said you sent out to 8 of us, would 3 return or would?
I will tell you this, out of the thousands of clients we have that are Meals on Wheels, we return about $200,000 worth of money back for that. So that includes Winnebago, Boone, Ogle, and Lee counties. So it's about $200,000. We sent out all the mailers. We can't track it. I couldn't tell you who's from Lee County or not. So, but all in, it's about $200,000 a year, which is a lot less than it used to be.
Gotcha. With increasing costs.
Yeah.
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 I
have-
think, oh,
Yeah,
I
yeah,
have
one
very
more.
limited experience with this, but my mother-in-law, who lived in Florida,
Yeah.
the last couple of years of her life, was getting Meal on Wheels
Mhm.
delivered. And when we went to visit her, she had an entire refrigerator full of food that she couldn't eat.
Right.
And she had so much.
Yeah.
How is that managed?
So we can get into the law. Here's what the law says, right? And this is what we try to. So you have to provide 1/3 of the daily recommended caloric intake. Plus, there's all other requirements. Vitamin A has to be in, vitamin B has to be in, yeah. So we have a registered dietitian that signs off on everything. All has to be low sodium, right? Everything has to be heart healthy. And then we also provide a diabetic option. So it has to, everything we deliver has to be 1/3 of the caloric intake of what the daily recommended for somebody is. So that, and again, a registered dietitian signs off on all of our menus for that.
So if they don't consume it, then that can't be on anybody that provides it. They just,
We strongly recommend that if a client doesn't like a meal that we're delivering that day, to call us and cancel for that day. We strongly recommend that. We don't mandate it, we don't, but that way we can save that money for future.
Sure. Mike, thank you for coming in.
Thank you, I appreciate it. Thank you,
Appreciate
everybody.
it.
We appreciate
And-
everything. I mean, I've been coming here since 2014, so I want to thank everybody. We've just such a great partnership with Lee
thank you
County.
for the work you do.
I appreciate it. Thank you.
For what you do.
Thank you. Okay, next on the list is Rock River Valley Hospice. We have a Jill online? Oh, okay. All right. I can't remember. Okay.
I'm Jill from I'm from the Mills and Petrie Library in Ashton.
Okay, very good. All right, thank you, Jill. Appreciate that. We'll let you know when we get down to you.
Okay.
Okay, so no representative from Rock River Valley Hospice. And they had a $5,000 request. We funded them $4,500 last year. All right, Catholic Charities. All right, come on down.
Hi, everyone. I'm Julie Schupner. I'm the program director for the Long-Term Care Ombudsman Program with Catholic Charities. And my +1 is Brody, and he is my community ombudsman that visits the long-term care homes in Lee County. So I think he just went to step out for a minute. He'll be
Yeah,
back.
that's fine.
So thank you for taking the time to have us come again this year. Many of you, I see a lot of familiar faces, so that's nice. But just as a small recap, what we do is we are the designated advocates for adults that live in long-term care facilities, and that's skilled or nursing homes, as many people call them, assisted living, supportive living, sheltered care, the intermediate care facilities for the developmentally disabled, along with what they call an MCDD, which is a medically complex developmental disability home. We have staff, and we also have volunteers in our program. So our program covers the 9 northwestern counties in Illinois, and in those 9 counties total, we have roughly 115 homes and just under 8,700 beds, licensed beds that we cover. So the area of coverage is the same as the Northwestern Illinois Area Agency on Aging. And as I wish I could kind of copy and paste Mike earlier, because a lot of what he said applies to us as well. We receive federal funds for our program. We also receive state funds. The funds that we get in addition are for our 15% match, as Mike had also mentioned. And that match also helps cover the cost for mileage for us as an outreach program. Our office is in Rockford, but we cover a large area. So we travel as far as 2 miles one way just to get to some of our homes. And then we're spending most of the day in the county and traveling the 2 hours back. So I don't want to get into a whole lot of detail. I think a lot of you know what our program is. We've had a lot of conversations, but I'll be happy to answer any questions. And when Brody comes back, he can also speak as far as his place in the homes and what he sees being in there face to face more often
Sure.
too.
Tom, go ahead.
Okay, I understand, Rob. ombudsman does. You've explained it before in the past.
Yes.
Does Lifescapes not cover any of this because they don't go into the nursing home? Or do you guys cross over at all?
We have an opportunity now to work together that we haven't had in the past. So as far as being the advocates, we're the sole provider of the advocacy service. No, there's no duplication of our service.
Okay.
And we're designated through the Older Americans Act and the Illinois Nursing Home Care Act. So, all right. So there is no duplication, but there's times that many times we partner with other community partners. So Mike had mentioned Adult Protective Services and financial exploitation. I call it recently, but within the past 10 years, that has changed so that we can work together. So if, say, a resident in a long-term care home is being financially exploited and the perpetrator is in the community, we partner together on those cases now, where before we couldn't do that very well. And we've had a lot of success. So our program, I should say, also interacts quite often with many of the Adult Protective Service investigators. And we've been very successful because there's things that APS has the authority to do and obtain that we don't. So to explain that a little bit further, as our program is designated, the client is the resident in long-term care. They control what we do. They give us permission. They tell us we can and can't share information, and any conversation we have is confidential. So if a resident is unable to give us direction, then it states we need to look to their representative, which could be a power of attorney or maybe even a family member that they've designated to make choices. But if that person is implicated as the possible perpetrator in the abuse, then we could take it to our state office and we would take direction that way. At times we come up with a little bit of a barrier in getting things like banking statements. We have releases that we have the residents sign in order to obtain those documents. All banks don't want to give those to us. And if the resident can't sign and their representative is the alleged perpetrator, where do we go from there?
Right.
So at times, Adult Protective Services can get those statements easier than we can. We can, but we have to go through a path in order to obtain them. So we work very well with them. I was making notes as I was listening to everybody too, like, yeah, we work with them too. Mike had mentioned their RSVP program, which is the Retired Senior Volunteer Program. And as of last year, we collaborate with them. So we're partnering with them and working on getting volunteers together to do our work in our counties. It's been great. We've had a few volunteers that were with RSVP, but we didn't partner with them yet. So it's been a collaboration really of the word getting out from our volunteers to the volunteers at RSVP and then coming together too. It's been really great. So.
That's great. Any questions?
What's your annual budget?
For the program, I believe it says 617,000. I'm not totally sure fiscally how that works out specifically. I can get specific answers for you if you have them. But that's what I see, and that's what.
617,000 covers 9 counties?
Correct.
Okay, that's not just Lee County, that's
No.
all 9 counties.
Correct. Correct.
And how do you become aware of someone who needs advocacy?
Well, I mentioned we're an outreach program. So our staff and our volunteers are in the homes regularly face to face. We walk the halls, we knock on doors, go in and talk to residents, have those confidential conversations with them. How's the food? Are they taking good care of you? Is there any concerns? How are your call lights going? You know, having those conversations to see if they need help and explaining that we're their advocate and we take their direction. We also many times attend resident council meetings. Those are meetings that are held by the residents and they talk about concerns going on in the home. As an outsider, not a resident, we have to be invited. Staff have to be invited to those meetings as well. But most of the times residents welcome us into those meetings. So we can hear from those conversations what's going on. So we know if we have quite a few concerns with cold food at dinner time, well, we're going to start doing visits at 6 o'clock or 5 o'clock and watching the dinner meals come out. So We get complaints just by being in the building. However, we also get phone calls and referrals, sometimes from the other providers, such as the CCUs, hospitals, social workers, police, family members. So anyone can give us a referral to our program. And I think we've just about had anybody you can think of send us a referral. But we always start with the resident and start from that point.
So you find something that is out of order, what authority do you have to correct it?
So we're not regulators. Illinois Department of Public Health is the regulators. We, as the advocates, we try to fix it before the regulators have to be brought in. We work with staff. One of the main, staff and others, but one of the main differences between us and IDPH is that normally IDPH comes in if they get a complaint or if they have an annual survey for licensure for the home. We are in the homes much more regularly. So we develop those relationships with the residents, with the staff, where they know us. And that's how we really forge and get through to a point where if a concern comes up, we know who to go to, and they've worked with us in the past. So we have those relationships built. It seems to be a more effective way. Whenever someone files a complaint with public health, they have a process that they have to follow as regulators. They have to go through the regulation. They cannot cite a facility for a deficiency unless they have absolute 2 different pieces of proof where the facility failed in that. Because if they are appealed, their decision is appealed, they have to be able to support it with those 2 pieces of information or evidence. The problem is some things are he said, she said. You know, if a resident's daughter gives her $100 in cash and she leaves and the resident doesn't tell the staff, I've got this cash and it comes up missing, how can they prove that that happened? We always believe the resident. They're our client, of course. But IDPH is limited in that way. We try to fix it on a ground level. So I hope that answers your
Yeah,
question.
how do residents know about your services?
Well, we always say that we're one of the best kept secrets. Sometimes they don't know about us until they have a problem. However, we've got posters. It's mandated in the federal act that posters are up throughout the building. Every time, and Brody can speak to this too, that we're in the building, we're handing out our brochures, our business cards, making sure that our information is out and given to the residents. There's also a requirement that our brochure is in every application, that so anyone that comes in as a new admission, our information is required to be given to them. With that being said, sometimes when you're admitted into skilled nursing homes, you're there because you need help. So it may be family receiving that.
Right.
So another reason why we are in the homes, knocking on doors and getting face-to-face with residents. We also attend quite a few community education events and health fairs, any opportunity that we can, just to get the word out. We do presentations as well to a variety of organizations, caregiver support groups at NIA. Oh gosh, I think the Knights of Columbus we've presented at before, like there's no boundaries. Anyone that wants to know about our program, we'll definitely talk about it with them.
We
So.
provided training.
Absolutely.
We provide training to facility staff as well on especially resident rights, but you know, we've provided what we call in-service trainings to the staff at a number of different facilities.
Okay.
How many of your staff are dedicated to Lee County?
So the way that I'm gonna pass a couple of these around. These are some of the brochures about education that we hand out and mail out. So in our program, whether you're a volunteer or a staff, you have to be certified the same way. It's a very rigorous certification and training process. Classrooms, 36 hours. There's also hours of mentoring with another staff and certified ombudsman in the homes. After that, we have a continuing education requirement of 18 hours a year to maintain our certification. With that being said, any of our staff can visit any county. So we have various backgrounds with our different staff, and certain staff have very good expertise. So one may be very good with banking. So in financial exploitation matters, they assist the staff ombudsman with that. So it just depends. It's It's hard to say because all of our staff interact with every county very often. So, but as far as Lee, Brody's the designated staff for routine visits and to regularly be in the homes for Lee County, but our other staff are in there as well. Prior to Brody, it was me. I love Lee County. So I know it very well.
So your request this year is $3,000.
Yes.
And we were able to fund you last year, $2,250. So, anyway, well, we appreciate you guys coming in and appreciate the information, and, we'll do our best to fund you to what we're able to do. So,
Thank you. And we greatly appreciate it because, you know, as Mike had said, and cost increases have increased so much, just mileage to get our staff out.
Sure.
We have agency cars we use, but they require maintenance too. So we very much appreciate any consideration that you give us.
Yep.
So thank you.
thank you for what you do.
Thank you.
Thank you.
Next is OSF Meals on Wheels. Now, am I missing something? But OSF is a new addition to to that designation, isn't it?
OSF is a new addition to it. Yep. So previously, well, first off, my name's Linda Setchell, and I am a board member of Meals on Wheels, and I'm also the food manager at OSF St. Catherine, which used to be KSB Hospital. And I just celebrated my 20th year there, so.
Oh.
So anyway, OSF came in January, and they're continuing on all the same programs. So our Meals on Wheels program is slightly different than the other programs that we've heard about, in that we are strictly a City of Dixon program. You have to be in the city limits in order to qualify for the program. We charge $4.50 for the meal. The participant pays $3.50, and we can distribute to anyone. Like you guys could qualify, maybe you're gonna get a new hip and you need meals for a week, we could bring them to you just for 1 week. If you wanna be on 3 days a week, 2 days a week, we work with people however. You're here in the winter, you're gone in the summer, or vice versa. We work with everybody. So, well, I don't know what else you'd like to know. We serve about 40 people a day. We have 60 people on our program. Around 60, 65 people, but they're not all on every single day. So we feed an average about 40. Sometimes we go to 45 or 50, but we never really go over 50 right now. So we're asking for funding just to keep the program going. How do we raise funds? We're strictly donations. The churches in our community are the ones that will distribute the meals to the participants. So it's all volunteer run. We pay OSF St. Catherine for the food. And then we, because we only charge the participant $3.50, Meals on Wheels pays the difference. And we just recently were fortunate enough to receive some money from, we were a benefactor of someone's will. And when we received that money, now we're using that to buy a special meal, like 4th of July, Labor Day. We just do something. And then Meals on Wheels pays for it. We don't ask the participant to pay for it. So we're just asking for funding to help keep our program going.
Super. And your request is $3,500, and we were able to fund you $3,600 last year. So, very good.
Linda, the question I think was asked earlier, what do you guys do on weekends? Do you serve meals then also, or just Fridays?
We only serve Monday through Friday.
Okay,
And we serve a hot lunch, and we have a sack supper available if they want it.
thank you.
And the sack supper costs $1. So I'm with OSF, we're still doing the same thing. We'll be receiving a new management company for the food service in September. And I have a suspicion that prices are gonna go up,
Sure.
but
So my question is this, so obviously you said just City of Dixon are
Yeah.
the residents that you can serve, but like, for instance, there's neighborhoods, right, maybe we're on the outline of Lee County, but outside of the city. Have you thought about expanding your, that maybe just be a mile or even a few houses outside of the city, but yet very close. I mean, have you guys thought
We-
about that or?
We serve those people.
Oh, you do?
We go within just the city limits of Dixon, but if
Okay.
somebody is like in the neighborhood, I don't know, it's out by that place on Palmyra, whatever, there's a house out there and we had a person who wanted to be on the program. And so we delivered to them even though they weren't even in the city limit.
Sure. That seems to be, okay. Oh,
Yeah.
Good to know.
We'll take care of anybody that we can.
And obviously you work closely with Meals on Wheels on probably making sure those residents get served.
Absolutely.
Yeah.
You have,
And our volunteers, because they've been doing it for so many years, know the participants. And so, they'll go in the house and say hello and help them if they need something. And I delivered a meal and the lady made me come in and give her a hug.
Oh,
how do you avoid duplication of other Meals on Wheels versus your Meals on Wheels? How do you have some way of?
Well, they call us at OSF St. Catherine in the dietary department to sign up for Meals on Wheels. And so when we talk to them, if they're in the city limits of Dixon, they can sign up for our program. And if they don't qualify for ours because, we get a lot of phone calls for Papa, then we refer them to Lifescapes. And we give out numbers. We also do the same thing for Whiteside County. And we get a lot of phone calls from California County also. And
Interesting. Any other questions? Well, thanks for coming in. We appreciate
Thank you.
what
And
you do.
I'd like to
and-
apologize to all of you. I completely missed the meeting last year and I apologize. That's not like me, but going forward, Becky and I are on the right page and I'll be here.
Very good. Thank you.
Oh, and I'll add one more thing
Yeah.
about the Meals on Wheels. Suzanne Ravlin's back there and her grandmother is one of the ones that founded the program back in the 70s, I think, 78, was it? Something like that. So- Okay.
Yeah.
Well, it was around that time.
That's funny. Okay, City of Amboy. Anybody here from City of Amboy? No? Okay. All right, Dixon Public Library. Nobody here from Dixon Public Library? Okay.
Oh, that's right. She had that report.
Okay. All right. Well, if she's able to pop in, we will go back to her. Serenity Hospice and Home. There's. It's coming up.
Hi, good
Hi.
evening. Suzanne Ravland. You should give a shout out to my grandma. Her maiden name was Hermes. so.
Yeah.
You might know, but notice by my nose, I'm a Hermes. But here on behalf of Serenity Hospice and Home, also with me is a local Lee County resident, Jacob Fain. He is now our Director of Finance. So excited to have him on board. And our application for this year with Lee County is in relation specifically to our bereavement services. And what I think is so important for the senior citizen services aspect of this is really the grief support. So what we're starting to see is grief starts actually before dying. And we see that a lot with our senior citizens. Life is looking different and it's playing a huge part in their role in their life. And so we want to be able to provide those support services, not just when you're become part of hospice, but ahead of time. We also have a palliative care program, which is kind of for us pre-hospice. It can last, our hope is 5-6 years you're in our palliative program, but being able to provide those grief services is really important. As you maybe saw in the numbers, we are seeing a large growth in our hospice services in Lee County. I'm very excited about that and proud of that. I think the fact that we have a home, which is very unique, it has fiscal challenges to it. There's a reason why there are very few hospice homes because of the financial aspect of it, but that's something that we will always have and is a part of who we are.
Where's it located?
It's in Oregon, Illinois. So
Oh,
right on
it's the one in Oregon.
Yes.
Okay.
Yes. we're the ones, yes, we are. And so the other part of this is serving Lee County and getting more members there, making sure that there is a place for our senior citizens. So being an independent nonprofit hospice is really important to us. And so what that's going to mean in order to serve the counties in Lee County and be able to stay and have that home is finding ways to expand kind of services like grief services. And so we have, I call us the duct tape organization. We've duct taped a lot of things. I don't know about you guys, but living on a farm, you duct tape everything. Your pants might be duct taped, I don't know. So that, you know, we've definitely to a certain extent stockpiled, I think. But what we need to do is it's part of our commitment to our community, because in order to be a nonprofit and provide services, we want to have that long-term independence and be able to do things like last week, I just have to share a story. Last week, we were able to take a man fishing and also bring a red and white cow to our facility. A gentleman wanted to, you know, touch a cow and pet a cow one more time. And we, you know, they said, can we do that? And I said, absolutely. I was on a pig farm. I know how to shovel things and we can get it done. And so I think that's important for our senior citizens in this idea of grief support, being able to come to them and provide services that are unique. And some of the entities that you've heard of today have a whole other mission that is huge and important. And sometimes when we go into homes or we have these interactions, we're able to connect them with Lifescapes and the services that you heard of tonight. And so that's really important. And I'm proud to be sitting here among my colleagues that are doing this work. Any questions?
A little unnerving that you deal with end of life and duct tape.
Yeah.
With the different hospice entities in the area, how do you differentiate who gets kind of what? Is there a territory? Is it, I mean, how does that get decided?
Yeah, that's a great question. I mean, one of the things is what we see is the for-profit world is getting a lot more aggressive when it comes to, you know, you heard about it today, you know, abuse, elder abuse, and seeing what it, you know, financially they can do. And so we are strong believers, me and the counterparts of nonprofit, of supporting each other. And so if one entity needs help, you know, we're going to help each other if it's from services. So we try not to, you know, kind of, for lack of a better word, stay in your lane. I think we know that we can best take care of the people that we live closest to. And when you think of things like mileage or where people are going to be able to be closest to home, you know, we want to honor that. And so there's a lot of, you know, hey, how are you using your electronic medical record system? A lot of, you know, questions being asked of each other and giving each other answers. And so I think that that also shows up in where we choose, at least I can speak for our organization, the amounts of requests that we have and who we're requesting them from is important, because I think it matters where you're serving your territory and whose taxpayer money is going towards it.
Does Ogle County participate in supporting you as well?
They do. Ogle County has, it's called a 708 board, so a subsection of what you do, I think, here on the board. And so they call it a mental health grant. And so we do ask for their support and proportionately as well. I think that's a big part in kind of what you were saying, Jennifer, of, you know, what the requests are.
Mhm.
And how big a staff do you have?
So overall, we're right under 100, which is a good number to be if you're aware of mandates and things of that nature. About 60, I would say, around 60 full-time. You know, the best thing is we have over, I think, 4 full-time employees, 4,800 hours of volunteer services. So we rely a lot on our volunteers. I love how everyone here is speaking and saying we're going to get it done no matter what. We know that the best thing, especially even with the groups we're talking about here, is to do it in groups as well as individually. So we're going to start having locations in Lee County. We're really seeing this growth. We're in 9 counties, but Lee County has jumped up to well over 20% of our patient population. And so we serve, over 100 patients a day, not at the home. That's an 8 inpatient bed, but we do serve a lot of our patients inside of their homes or long-term care facilities. And so the growth is extending out to Lee County for sure.
Just I wondered how long you would see a patient for. What's the average length of? I'd say stay, but you said they're not staying at the facility or whatever. But yeah.
Absolutely. So in terms of our palliative care, so kind of supportive care before that, our average length is 120 days, and that's about 70 patients today. But for those 100, the average length of stay is 80, but the reality is we have patients on hospice that are well over, a 6-month renewal. And unfortunately, we have patients who are often between 1 and 3 days. So 15% of our population, and you always hear the loved ones say, I wish we had brought our loved ones sooner, right? And so there's a lot of factors there, that we hope to educate through kind of that grief support process of, hospice does not mean you have to stop everything. There's some misconceptions, and that's the beauty of being an independent, nonprofit, is to individualize it and make sure that we have that. And so our proud number, instead of looking at that average, is that we are over right around 51 days for our patients in hospice. But certainly that's my, advice today is just, your loved ones, have those conversations sooner than later to see if we can help in any way.
I think that's a really good point, Susan, is that, it's a learning process. And having gone through it with Dad and Bird's mom, both of those were completely different circumstances. So it's so private and it's individualized, and most of the time, those of us that are trying to give the care, we have no idea what we're doing. And we just, that education is huge.
It is. And that's probably a better even word is grief education. I might steal that from you, to be honest, because it is the people supporting them that need a lot of, that personalization, which is, again, something that we pride ourselves on. We do not have any time frames, time limits with any kind of appointments or anything like that, even if our employees are paid hourly. That is something that's, crucial and crucial to our population, our county, and the area that we are. And so we want to make sure to keep that.
Help me understand something. I have experience with hospice and palliative care in Florida, not here. And in Florida, it seemed like the palliative care somewhat competed with the hospice care. Can you distinguish the two and how they function?
Yeah, absolutely. So palliative care, Jacob's been learning a lot about hospice and palliative care, so I'm kind of smiling. I won't put him on the spot, but what I like to say is it's the word is palliative means supportive care. And I think that it's an injustice because it can be so, the scale is so different. So care coordination, I probably qualify for palliative care as a type 1 diabetic. If you have a number of chronic illnesses, a hospital might try to get you into palliative care. But for us, palliative care is when you are approaching some sort of an end of life diagnosis. So we don't want to compete, again, talking about other programs, we don't want to compete for coordinating one's care or pain management. We want to be there for a dementia patient. We want to be there for someone who's going through cancer. So we can help those loved ones be like, yes, we do notice a difference in your mother or your father, or your spouse, right? That's our kind of palliative care. Palliative care a lot of times is, a lot like a doctor's visit to a certain extent. And there's a lot of different ways to do palliative care. But it can really help in that continuum to get to.
You use the term pain management. So explain to me, if palliative care doesn't take care of pain management, who does?
Yeah, I mean, it should towards, if you think of I just described a cancer patient, right? And so they may be experiencing pain in areas that isn't related to their cancer. So then they're seeing a lot of different doctors. So we would be the person, our nurse practitioner goes into the home and kind of has everybody dump out all of their medications, right? And have one person that you can call to walk the family through all of that, medication and what you're on. And what is shocking to me is how often, whether it's palliative or hospice, we go through that and are able to remove a lot of medications and how much better people feel.
Yeah.
And it's just because somebody's able to look at it differently, no judgment
Right.
on, that doctor is trying to cure the cancer, but not looking at the holistic. And so, palliative care, that's my hope that all palliative cares are that way and programs, but not all hospices are the same as us either. So there is some differentiations there.
Thank you.
Great question. And I could talk all day. So if you ever do need it or a loved one, and that's certainly another thing is it's all about education. So my colleagues here, I'm going to be hitting them up for coming on over and having those conversations, seeing how we can meet with people. Thank you.
Thanks.
Thank you.
Appreciate you guys coming in. Yep. All right. Next is Village of Pawpaw. We have anybody from Pawpaw here tonight? No. Okay. Yep. Yep. Okay, Jill from Ashton.
Hello.
Hi.
Hi. Like I said, I'm from the Mills and Petrie Library in Ashton. I think previously maybe Tim Hennert or Laram Mamini went to the meeting. I don't know. This is the first time I've even filled out the application.
Sure. Yeah, that's right. Laram was representative of Ashton, and did a presentation a couple, 3 years ago, something like that. But yeah, anyway, go ahead, Jill. What do you have for us tonight?
Well, we're a very small library because in Ashton we have fewer than 1,000 people, but we do also serve people that are in the country, like myself. And our library also has a gym attached to it. So we're trying to provide services for elderly people in the gym as well as in the library. So for instance, we have a fitness class that we had during the winter. We also have the gym open for walkers, and it's primarily older people that are using that for walking. And then we have some social activities like card night. And we are also using the money to buy large print and audiobooks for some of our patrons that are elderly and use only one of those two. They either only use audiobooks or large print books. So we've been able to update our circulation with newer large print and audiobooks.
Very good. Thank you. Any questions for Jill?
Jill, how's the library staffed?
We have 4 part-time staff. 3 of us work. I mean, we on a regular schedule, but then we have one person that will fill in if any one of us is sick or unable to, or on vacation or something.
And what's your annual budget?
I think it's around 120,000 for the gym and the library. I'm not sure about just the library itself. I don't have the papers with me here at home.
And what other sources of revenue do you have besides what the county contributes?
We do get money from the village of Ashton through the taxes, since it's a library. And then we also have library dues for people that live outside of the city limits, which I myself live outside the city limits. So I have to pay the non-resident fee. And then like I said, we have a gym. So the gym is also a venue for hosting events like weddings or birthday parties and things like that. So we get some income from that. And then also from other like donations. And we have a lady, Marilyn Bloom, that when she passed away, she allowed, or in her will, she specified that the library was one of the entities within Ashton that could receive money from the interest of her, the money that she had in different investments.
Mhm. Mhm.
Thank you.
You're welcome.
Any other questions for Jill? All right. Well, thank you, Jill. Appreciate you joining us tonight and explaining what you're doing at the library, and we will let you know.
Okay, thank you very much.
All right. Thank you.
Mhm.
Okay, our last presentation tonight, if there's someone here, and she's here. The last presentation, United Way of Dixon. Or of Lee County, I'm sorry. Ugh. Yikes.
Of Lee County, sorry, and also United Way of Ogle County. So out of our office here in Dixon, we work in 2 counties now, and I've been at United Way for about 2 years. So I'm very excited to be here to talk to you all today, particularly the program that I wrote the application for was our 211 helpline. So 211 is a program that United Way facilitates so that the community is able to have access to that helpline. So it's a 3-digit number that anyone in the community can call at any time to be connected with local resources. So it's 24/7, it's free and confidential. And so if anyone in our community is looking for assistance, let's say they just lost their home and they don't know what to do, they can call 211 and tell them, I live in Lee County, I just lost my home, can you help me with this? And they can direct them through a database of resources to a local organization that might be able to assist with that. So essentially, I feel like 211 is a great resource for our community to have because anyone is able to call that when they're looking for assistance. So I did also, with our application, put in how many people called the helpline last year. So in 2024, Lee County had 304 individuals call the helpline for assistance. And out of those 304 people, 367 needs were identified. So that's telling us that if someone's calling the helpline, they might be looking for assistance with more than one thing. And from that, they were able to receive 567 referrals. So what I attached looks similar to this with my application. This is an impact dashboard that I can check monthly, quarterly, daily. I can pull our numbers and say how many people called this last month. So that's really great for us to be able to see that data. And particularly related to seniors, when I looked at all of 2024, we had 29% of our calls came from individuals in our community over the age of 65. So that was the highest demographic that was using the helpline. And then we look at 13% were over the age of 55. So 42% are 55 years of age or over that are calling this helpline, but we can see all of the age groups that are utilizing this. And I think for us at United Way, one of the biggest benefits of this helpline is that we can see what people are asking for help with. So we can see month by month how many people are calling and what they're looking for assistance with. So for us, if we have 304 people call, we can see 137 of those calls were looking for housing and shelter. 49 were employment and income, 26 were mental health and substance abuse calls. So for us, I feel like at United Way, we do a lot of fundraising and granting out to make sure everyone in our community has access to these programs, because we know our office, we can't do everything for everyone. So we we provide funding to 35 local nonprofits in Lee County that do a lot of this work. But for us, this is great information for us to see where we should be directing those funds. And that is all 100% stays local in Lee County. But also this data is very beneficial for us in making those funding decisions. But I think something that having this helpline in Lee County gives people peace of mind. They know they can call if they need help, and they keep an updated resource database. So, in our application, what we requested would be that $3,000 would be the cost of running this program for the entire year. So that's covering, we pay a call center. So when someone calls, we don't answer the phone in our office. We pay trained, qualified staff that pick up the phone, that then are able to pull up a resource database and update that. We also work on updating that resource database in our office. So that funding helps us update it, keep it up to date, spread the word, provide those resources to the community, because the helpline is only as good as it is that people know about it. So a big thing for us is marketing that. We provide that information to our 35 nonprofit partners. So they all have RAC cards, business cards that they can pass out. We're going to Tools for Schools this week. So we'll make sure, if we can pass that out to the families that are coming through at Tools for Schools and PAWPAW. So we really work on getting that out across all of Lee County, this information. And it's something that anyone can call at any time. So that funding will help us ensure that this is something that stays available to residents in Lee County for the year. And, our goal in our work that we do, we run this, we have the mini food center that's at the Dixon Public Library. We also run our Summer Eats Meal program. So we work really hard to fund all of these programs so that when we're out fundraising, we can keep supporting a lot of these wonderful nonprofits that are here tonight as well and help support that. So our goal is to get all of our programs 100% funded, but everything we do is donation-based, grant-based, individual donors. As far as the money we bring in, we don't receive any money from the state or federal government.
Okay, questions for Ashley? Go ahead.
Yeah, Ashley, I several, so I apologize in advance. So does Lighting Center no longer support any of that program 211?
We don't receive money from Leidig Center.
Okay, when that program came into existence, Lighting Center supported half of it.
Okay.
So I don't know what happened there because I'm no longer involved in either one of those, but.
Yeah.
The other question, I guess, is, and you touched on it, but I'm not sure how well, and this is not, don't take this as negative. I don't know how well the program gets advertised to people. I used to see the Winnebago one on television and I kind of laugh at it thinking, if I don't have anything, how the heck do I have cable TV to see 211? I've brought it up at meetings like at a KC meeting. Has anybody heard of 211? People look at me like I'm talking from somewhere else. I've asked priests, I've had ministers. No, not aware of this at all. So just as a comment, okay?
Yeah.
Constructive criticism. I've thought about this since January. I'm gonna come see you. I've done nothing. So I failed, okay? But I think we need to do a better job of getting that out to people because when I was on your board, I remember there was a guy came to Salvation Army and he had lost his home, but he also lost his billfold and everything in the fire. He had no ID. He had nothing. So, I mean, they were able to help him. And it was very touching to me to hear that story, how that worked. So I'm envisioning this person who really is down and out. And how do they find out about 211? And yeah, you can borrow a phone to call, but I mean, we all have opinions of different people and different attitudes and how they survive. But it just concerns me that, so I'm glad you're here.
Yeah.
I can ask those questions and share that.
No, that's a really great
thoughts, you know.
question and our comment. And I think one of the things since I've started the last 2 years is working to build this program in our community. So, giving those RAC cards and business cards out to our nonprofits. So we think we have 35 organizations that have access to give these to their clients.
I used to have them on the wall at Lighting at one time when I worked out there.
Yeah.
But it just.
And getting it to the places where
Yeah.
the
just how
people are
know about
that
it.
might be.
Because it is a wonderful, wonderful program.
Yeah.
I think it's great. I
Thank
think it's
you.
worth the money to do it. It's just, how do you get people to, because for me to sit at home and watch it on television.
Yeah, and TV
I feel bad
ads
for that person
are
who's
very
down there under the
expensive.
bridge
So
or
we're
in a
always
tent
looking
somewhere trying to
at,
figure out how they're gonna find out about it.
we're always looking at the biggest bang for our buck as far as how we can advertise that. the most inexpensively, but getting the word out the best we can. So I think partnering with the organizations, the schools, the hospitals, working with
Right.
a lot of our area partners that we have those partnerships with, I think will help us be able to utilize the funds to cover the cost and also purchase those materials to hand out, which is part of that built-in funding for getting those materials purchased to get out as well. Print, social media, radio, things like that.
And
The
also,
other question I have based on, you brought it up, so this one's you. 29 people are looking for employment. Is there anything in 211 that can help somebody find a job? I mean, I think of all the other things that are out there, but
Yeah, so a lot of what we're looking at, and we can see typically, and I don't have that with me, but it'll break it out and we can see where they're referring people to as well.
okay.
And some of the places they refer to aren't even our nonprofit partners, so
Sure.
that's even a learning experience for me of when people call us, at our office, I'll try to answer that as the best I can and refer them to contacts I have. And then I say, if you don't get anywhere, 211 is also a great resource to try to call. With that, it also shows us needs that go unmet, which to your point, if someone calls and there's something that's not available in our community, I think United Way is poised in a really good position to see that unmet need and think, how can we work with another organization to meet that need? So I think that's a twofold thing that we're always working on, getting up-to-date information and getting the information out to people.
Another question. Sorry. Since you guys have partnered with Ogle County, is Ogle County paying part of this?
No, so this is just Lee County. So
Okay, so they do not have a 211.
Ogle County has 211. We keep everything separate. So the
Okay.
money I'm asking for from Lee County would just be for Lee County.
And
211.
I thought it was been $3,000 before for it. That's, I'm just curious how you separated. So if I'm in Grandy Tour and I dial 211, who do I get?
So they'll ask you what county you live in.
Okay.
Yep. So
Thank
that's
you.
how they establish. And the great thing is this is 100% state covered now. So a lot of United Ways have picked this up for their county. Last year, it was only 73% of the state had 211, and now it's 100% coverage.
Yeah.
So now anyone in the state of Illinois can call, and Illinois 211 is really using that to their advantage to build relationships. So they just formed a partnership with AARP, the caregiver program. So they're now referring people to call 211 as well. And they're working to work with other Illinois entities of using the number as well.
So you answered all my questions. I won't be coming to your office now to pick your brains.
I'd love
Well,
to
you
have
can tell
you wanna
you have
talk
a
to me.
passionate, you have a
I was gonna
passionate
say, I'm
advocate
always-
here.
I love hearing about,
I do,
if you've
because
run
I
the
went
board
to-
and history, and I love learning about that.
Because
So
I went to Leidy
anytime.
to get the funding and then had Jen Cook go out and do the paperwork, but to get it covered, to get half of it covered to start with.
Yeah, no,
So I'm
that's great. We
disappointed they
haven't,
backed off on that, but.
we're always open to partnerships. Yeah, if they're interested.
Jennifer has a question.
well, I was just gonna say, just from a different perspective, because as a prior Lee County United Way board member, I do have a different perspective because I have seen billboards. And I think it's one of those things, I just want to commend the program because I think it's also, you don't see it if you don't need it, right? So there could be a 211 billboard, and if you don't understand or don't know it, you're going to drive right past it and not understand it. So I have seen the advocacy of it. I think that it's one of those, as long as you are telling the people that if I need a service and I know to ask you, or I know to ask this board member, I think that's huge because you're not going to get to all the people all the time and nobody cares until they need it, right? So I just wanted to commend United Way for that because I have seen that. And I mean, questions are good and different things like that, but I think it also, it's your vision and what perspective you're coming from. So I just want to make that point. So. Thank you.
Very good. I don't want to act like I was attacking the program because I think it's a good program, but it just, you talk to a lot of people and they look at you and go, what's 211? What are you talking about? Especially when it's ministers and priests and, you think, because they have people come to them all the time looking for something.
Oh,
So
yeah.
just
Yeah,
and
that's
maybe
been
it's another
great
place to put out some cards. I don't know.
that's a great idea. And this last couple months, I also made a point to meet with our local senator, our local representatives, also making sure that they know about that information too, at the state level and legislative level.
Were you aware of it, Nancy, prior to
Oh,
this?
yes.
Okay. I mean, prior to that?
Yeah.
Okay.
Yeah.
Okay. Thank you.
Awesome.
Any other questions for Ashley? Well, thanks for coming in, Ashley.
Thank you so
We
much
appreciate
for
it.
having me. It was
Yeah.
great meeting all of you and sharing about the work we're doing. So thank you
Right.
for what you do as well.
Yep. Thank you. All right. Am I going in and out? There we go. Maybe my battery's getting low. We're done for tonight. So, but bright and early tomorrow morning, 9 o'clock, you see on your agenda, the department heads that we're going to be covering.
Thank you all very much for all the work you do and for putting up with us tonight.
And also just one final announcement, which I should have said earlier, but all the FY 25 allocation disbursements have been issued. So if you have not received them yet, they are in the mail.
There you go. Check is in the mail, right? All right, if there's nothing else good for the cause, I'll entertain a motion to adjourn for this evening. Moved by Naylor, second by Kitson. All those in favor signify by saying aye.
Aye.
All opposed, motion carried. Thanks, everybody. Appreciate your attendance.